The Katie Hall Foundation's Foxy is inviting us to meet with the Sickle Cell Task Force just to make sure that we're being very strategic as we go out into 2024 and 2025 and beyond. So just wanting everybody to know that things will be definitely more uniform, and so we all know what's happening, and then we're all being strategic across our region. Awesome. Maria, happening, and then we're all being strategic across our region. Awesome. Maria, happening, and then we're all being strategic across our region.
Still waiting on Ken.
Maria, happening, and then we're all. I'm not talking anymore. I don't know why I keep talking.
Yeah, Ken is here.
Okay, awesome. All right. So Maria, do you want to set us up across the top and then we can get started?
Yes, ma'am. Let me record. Okay, great.
Good morning, everyone.
Good morning, Ken.
Let me know when you're ready to start.
I think we're ready. So Maria, are you able to fix us as like a banner across the top of the page or no? The speakers.
Everyone is pinned at the top. Maybe adjust the viewing of the rest of the audience.
Okay.
Yes.
All right. I see everyone. Well, can we get started? All right, awesome. Well, thank you everybody for being here today, on this October the 7th, on this Saturday morning, going into the afternoon to talk about sickle cell and sickle cell patients. I'm KD. I'm with the Katie Hall Foundation. I'm the co-founder as well as the executive director. I'm also a parent that advocate for sickle cell anemia, and that's the reason why I'm here today. I would love to introduce our wonderful panel, and if everyone could talk a little bit about why you are here, how do you connect to sickle cell, and go from there. The first person I see on my screen is Megan, so I'm going to go to you first. And if you can give us an introduction for about a minute or two.
Sure. Well, it's just an honor to be here. My name is Megan Dulger. I am the regional CEO for the Red Cross here in the Northwest. And I have worked for the Red Cross for 17 years. And a big part of that has been supporting, blood products making their way to patients in need. But it's really only been for the last few years that through my Red Cross experience, I've been keenly focused on how we can better support the, over 100,000 people with sickle cell disease here in the United States. However, sickle cell has been something that I've been thinking about a lot since I was about 8 years old. And one of my closest childhood friends in my ballet class was gone from ballet for a good stretch of time. And she was a sickle cell warrior who was in the midst of a pain crisis. And so over the course of our friendship, this is something that I observed many times, and I understood how vital the need for blood that was a strong match was for my friend and for so many others. And so it's just an extreme pleasure to be here with so many experts and advocates today.
Thank you so much, Megan. I absolutely love your personal story. Man, I didn't know that when we saw each other at King 5 about a month ago. Thank you. And Dr. Bender, can you go next?
Sure. I'm Bender. I am both a pediatric hematologist and a molecular biologist. And I have been fascinated and enthralled by sickle cell and other hemoglobin disorders since early in grad school. When it became clear, it is sort of, to me, the ultimate disease, that it calls upon all aspects of medicine, society, public health. Everything you can imagine gets called into sickle cell in one way or another. And unfortunately, it calls into play a lot of things that the medical system both is not good at and tries to avoid often, such as care for Black and African Americans and non-whites, those with chronic pain, those with chronic disease, and So there's a huge need. And at the same time, I'm into education. And it's something where, while I'm a molecular biologist, education can do so much to keep patients healthy, happy, living a full life.
Thank you so much, Dr. Bender. I definitely remember meeting you back in 2015. I want to say when KJ turned 2 months old, and the journey's been real. So thank you so much for being here today. We appreciate you. And Ken for me is inspiration. And so Ken, if you can please introduce yourself and tell everybody who you are and why you are here.
My name is Ken West. I am a sickle cell warrior. I'm also president of the Metropolitan Seattle Sickle Cell Task Force, and have been living with sickle cell for now 64 years. So that's part of the story, but I'm a mentor, public speaker, and advocate for people with sickle cell.
Thank you so much, Ken. We appreciate you. 64, you don't look a day over 34. I mean, seriously.
Thanks for that. Yes.
Yes, thank you so much. We appreciate you for being here. And I see next on my screen is Ingrid Green.
I have to take myself off of mute. Hi, my name is Ingrid, and I am with the American Red Cross. In my role with the American Red Cross, I'm the emerging market manager with a focus on sickle cell. And since the American Red Cross has launched their sickle cell initiative in 2021, we have really been active in the community, going out into the community, talking about the importance of diversity in blood, especially among African Americans, to help patients that are suffering from sickle cell disease. I've only been with the Red Cross for almost 2 years, but it's such a great job, and I love what I do, giving back to the community, not only giving back to the community, but as well as doing something that I love to do. And thank you for inviting me.
Thank you. We appreciate you for being here, Ingrid. And we would like to bring Foxy to the screen as well. Foxy, if you can come onto the screen as well and tell us who you are and why you're here.
Thank you. My name is Foxy Davison. I have the privilege of raising 3 children, 2 of which do have sickle cell disease. They are incredible. They teach me things every day about what it takes to get up and live and thrive. I also have the privilege of working alongside of Ken as the director over the Sickle Cell Task Force, and we service people throughout Washington State who are impacted by sickle cell, and it's just an honor to be here.
Thank you so much, Foxy. I want to really give Foxy her flowers, and not to make you feel uncomfortable or anything, but Foxy has truly been a person that's been there for me in my 8 years of sickle cell. And even at times when I don't want to hear it, like, she has a way of still coming back and getting you to hear it in a way that you can hear it when you need to. And so, Foxy, thank you so much for spending time with us today, and also ensuring that we had like the right people on the panel. I want to thank you. I'm going to open it up to everyone. So really quickly, just for the people who are maybe watching, the purpose of our panel today is really to talk about sickle cell anemia or sickle cell disease. What are large impacts of sickle cell disease as well, or sickle cell anemia. If you notice, I'm struggling with using the word disease, and it was because of a conversation I had with my 8-year-old. Well, actually, Megan and I both had with my 8-year-old right before we went on TV. And she said, Mommy, I don't have a disease. It's a condition. And she was getting very frustrated with people saying that she had a disease. And so we're all here to learn. We're in the beginning of our learning spectrum on how to build KJ up positively, as well as being able to paint the reality of the condition that she lives with. What does the impact on Black and Brown communities? How does it impact us? How does it impact us financially? How does it impact us as far as like our abilities and the things that we can do? That's another goal of this panel. And last but not least, what is the beauty of being a sickle cell warrior or even contributing to sickle cell? So before we get started into our more targeted questions, that's going to talk about the science and things that might be uncomfortable for us, I would like to start with Ken first, because you are the person on the screen that's been living with sickle cell very resiliently for 64 years, may I add. Can you tell us what is the beauty of being a sickle cell warrior?
The beauty is learning how to be resilient and having perseverance. things do not come easy. I mean, you have a chronic condition that is hard on you physically and mentally, but learning perseverance, learning how to navigate hurdles and be successful, because you can be successful. Having that in the mind that you can be whatever you want to be, and how to achieve that is one of the good things about, if there are good things about having sickle cell, right? Learning that you can be successful, you just need to be headstrong and persistent.
Thank you so much, Ken. I appreciate you opening us up with that. And I want to go to Foxy as well, because we heard Foxy say that she has raised 3 children, and not only 3 children that she has had, but she's also the director of the Sickle Cell Task Force. Foxy, if you can tell us what it's like being a parent to sickle cell warriors and the beauty of it.
I appreciate the question. And I think that over the years, we've had to really flip that question around, thinking about it as beautiful. I acknowledge those who are living with this condition in the days that you don't feel like it's beautiful. So, but there's also this beauty that you get to see in community as people come together to, sometimes it's not to do anything but be there, right? It's just to sit alongside. I feel like the sickle cell community is a wonderful community to look into, to learn how to be with suffering and how not to change it, how not to, because sometimes as a parent, you can't do anything. And when you get to that point over and over again, all of a sudden you begin to figure out that just being alongside of people sometimes is enough. And there is a beauty in that. There's also, as Ken said, the strength that comes in this amazing community who chooses. It's a choice to get up some days. It's a choice to try to go to school. It's a choice to do many things. And sometimes they make the choice to lay down. And we've also learned that that's okay, right? This beauty of balance of sometimes you can't be resilient today and tomorrow maybe you'll be resilient, but that we're okay even if we're not resilient today, right? That we're okay if we lay in the bed today, but tomorrow we'll try again. And so I think for me, the beauty I have found is not, sickle cell community has taught me humanity in such a deep way that I'm still learning from day by day.
Well, I love that. I love that so much. And thank you so much for talking about, like, the beauty of it. And I would even say that making that choice to stay in bed, there's resilience in that. There's so much resilience in that in itself. Thank you so much, Foxy. And Megan, since you shared that story with us when we opened up about your 8-year-old friend, and I think you said, was it gymnastics or
Ballet, but close enough.
ballet?
Yes.
Yeah, ballet. Can you just share with us
chromosomes need sickle. The other could be another sickle. But the tricky thing is it could also be hemoglobin C, giving SC disease, something called hemoglobin D or hemoglobin O, or a whole set of things called thalassemias that are combined. And as a result, it's tough. Counseling isn't easy. And there's this big mistake people make. If they know a woman has sickle cell trait and they know the dad doesn't have sickle cell trait, people often say, oh, you're safe. You won't have a child with sickle cell. But dad could have this thalassemia or hemoglobin C or hemoglobin O or the others. And this is a huge problem at many levels. One is bad counsel.
This meeting is being recorded.
One is, inaccurate counseling or advice from others, whether they're friends, community, medical professionals. But the other thing is when you get that bad counseling, you can imagine the messes you see. You get a beautiful, healthy baby that you know has sickle cell disease. The family comes for the first visit. Mom knows she has trait. Dad knows he doesn't. And what happens? Dad's asking, who's the daddy? Mom's saying, why don't you trust me? And so now instead of the focus being on this beautiful baby with this chronic disease, it's this, lack of trust, which comes from bad counseling as opposed to that awareness. And so it's the diseases that really lead to the problem, the sickle with one of these other abnormal things.
Thank you so much, Dr. Bender. I appreciate that. And we're gonna dig deeper into that conversation as well. Great. When I met 15, his mom was the first thing she told me. I'm like, okay, I hear you. And I never knew about the C until we had KJ. When I met you and Foxy and everybody else, that's when I found out that I had the C trait. So it is very important to be able to know. I want to go to Ingrid. So Ingrid, I don't think that I had a chance to ask you about the work that's happening right here in the Pacific Northwest that American Red Cross is doing for people living with sickle cell.
Oh, yes. Can you hear me?
Yes.
Oh, the very sure. Okay, thank you. Wow, the work that the American Red Cross is doing on the Sickle Cell Initiative since 2021 is amazing. What in the region, what we've done as the American Red Cross, what they did was they hired sickle cell account managers across the country. And in each location across the country that has a large population of African Americans, and myself as a sickle cell account manager, we are tasked to go out into the community to talk about the importance of blood diversity. And what we're doing is that we're using the 5 pillars of best practices in recruitment for African American donors. One is trust. We go out, we have to build that trust within the community. And we're doing that by partnering with existing partnerships with civic organizations such as the NAACP, 100 Black Men, as well as developing new partnerships with like the D9 fraternity and sororities that are predominantly African American to have them to host blood drives within the community. So when they're hosting blood drives, they see someone that looks like them giving blood, and that way that will encourage first-time donors to come out and donate blood to help patients with sickle cell disease. Second is awareness. You'd be surprised the number of African Americans I speak to that's really not familiar with sickle cell disease. And you would think, wow, everyone of African descent should probably know about sickle cell. And just building that awareness and talking to them how there's over 100,000 African Americans in the United States that are currently living with this condition. And we as African Americans are released to donate blood. So when a sickle cell patient, as we know, needs a blood transfusion, they really need blood for someone of similar ethnicity or race. And if we are not donating the blood, there are times the blood is not there. So building that awareness in the community is what we're doing as well. And as far as convenience, making it convenient for first-time blood donors. Have blood drives in the community. Don't have them driving far away to give blood. Having it in the community. And education. Just educating what we've done myself. We do lunch and learn seminars at schools, at different churches, at different civic organization meetings, as well as being present at health fairs and talking about sickle cell and passing out information. And then autism, working with a sickle cell warrior. I have a perfect example. I did a blood drive with Kappa Alpha Psi fraternity a year ago. It was the first blood drive with us. And our blood program leader is a sickle cell warrior. And we did such a great job at that blood drive. And he has committed, he and his chapter has committed to having 2 blood drives with American Red Cross every year. And that's great because now we have someone who's a warrior that can speak for us as well and talk about the great work that the American Red Cross is doing. One of the great things from that blood drive was that another thing that the American Red Cross were doing is that we are providing sickle cell trait testing when we donate blood. This is so important because, as I explained before, there's a lot of people that are not really familiar with sickle cell, but there's people that have sickle cell trait and don't even know about it. And that leads to, as you say, having a child with someone, and then your baby has sickle cell, have the sickle cell condition. At his first blood drive, he came back and told me 4 of his fraternity brothers came back to him and told him that they had the trait and they did not know it. That's what we're doing in the community with the American Red Cross, getting the word out there and helping individuals to know more about this condition, as well as talking to other and educating other people as he talked, as well as what we're doing on the high school level. American Red Cross, a lot of our blood drives are in high schools. And so we have a sickle cell scholarship program, so that if you are in the top 10 of the most school with the most African American student donors, you will receive a $5,000 scholarship on top of the scholarships that we offer of the regular Red Cross. And so that's getting the word out to where we started them young, because we found out that if you start donating blood young and understand why you're donating and what you're doing to affect the community, there's a big chance that we can continue to do that for the community.
Ingrid, thank you so much. You hit on so many really good points. And it's true with the blood. I remember trying to give blood in college and I could never give it. And then so once working with you all, you're like, were you drinking coffee? I'm like, yes. Did you eat breakfast? No. I was going to my 8 o'clock class and I was trying to give blood beforehand. No, I didn't. And so, and that was really important with the blood drive that we did with you all in partner. And we want to thank you all for that. We have food available for people. We made them sit down and eat. Afterwards, we made them drink water, and they were really happy. I thought that it was the people who gave blood, and I think that we had no shows. Everyone showed up. Some of us were not able to give blood for different reasons, but everyone showed up for it. So I want to thank you all for doing that with us. You also talked about that you all also are doing testing for traits during the blood drives. I think that that's very important, very, very important. We were with the Washington Therapy Foundation earlier, maybe about 2 months ago, and there was a lot of people in the room. They're like, I think I have it. I don't know. I think I heard from my aunties that I think I might have it. So I think it's really important that we do know if we have the trait. I will say after my daughter was born, I have 6 siblings and 5 of us have C. We didn't know that because no one else has sickle cell like in our immediate family. And now we have also learned that a lot of my nephews also carry the C trait. So now that we know this, now we're educating the kids and just making them more and more aware. And it also makes KJ feels comfortable that other people in her family carries part of that gene as well. So thank you so much, Ingrid. I want to go to Foxy next.
Can I interrupt real quick?
Yeah, go right ahead, Dr. Bender. And then Foxy, I'll be to you next.
Trait testing is fantastic. To me, what's often better than trait testing is getting test results that are already out there. Okay? So for example, in Washington State, every newborn born since 1992 was tested for sickle cell and trait. Most families, children, young people that have trait don't know their status, but the state newborn screening program has the results there. So pretty much everyone born in Washington that's 30 or under their test results are already there without a finger poke or anything.
Yeah, Dr. Bender, and that's wonderful. And I think part of the issue is, like, I know I'm an old millennial. They call me, they say I'm a geriatric millennial, and I take that because I like being partially Gen X. But for a lot of us, we've moved, right? A lot of our generation, we don't live where we were born, and that's part of the problem. In Michigan, for example, they weren't doing all of that, right? I think, wasn't it, and I might be wrong here, was it 2006 when it kind of became, thank you, because I said 2005 the last time, when it became more of a national thing. And I think that that's also part of it, because a lot of people in Washington, a lot of us are transplants too. You know, I just think that's also another piece to consider.
But yeah, and every state is different, and how long they keep records varies. But I'm just saying, you know, one is, you know, getting tested. The other is using a provider to access results that are already out there.
True. Thank you so much. Thank you so much. And so since we're going right to really Foxy, when I met you, it was when I first found out that sickle cell was in my daughter. So I guess what I want to know from you is, what advice would you give to family members of those recently diagnosed with sickle cell, if they don't know anything about it or if they know a lot about it? When I found out, you were the first name that was given to me when my daughter was 2 months.
Okay, I'm going to answer your question. I just have to follow up on Bender's. Is it possible for those who live in Washington or in this age bracket, I heard you say, go to your local provider and they can pull it, or do they have the ability to pull this information themselves? I just want to make sure they're getting that resource, Bender.
Yeah, so there's two things. There's what can happen and there's what people are willing to do. Okay, so any provider can call and reach the newborn screening program and get the result.
Okay.
Many providers already have online electronic access and can just look it up themselves, right? But one of the problems in healthcare are these super short focused visits where you add things like that, and offices often are not set up to or willing to do that extra effort.
Okay. All right. That's just really helpful for folks who are here listening. If they want to know and not get poked, where do they go next, right? I didn't know if they're going to end up going on the Department of Health website trying to find it, or if they need to go to their providers. So that's really helpful. And I think in that, Katie and I have the similar situation where, with the C trait being present and the provider not knowing that the C trait actually can cause sickle cell disease. So it's quite interesting to me, because I know when going to our provider, we did all of that work, and it was actually on there that I had C trait, but the doctor was unaware that that caused sickle cell disease. And I'm just putting that out there because I put it out there every time I possibly can for people to, absolutely entrust your providers, but also have some information for yourself so you know what you're going in with. To your question about, what advice do we give? Is that the question to folks just starting off on this journey? Okay. When I first started off on this journey, I was very reluctant to be a part of a community. I actually, for the first few years, didn't go to anything around sickle cell. And I say that to say that that's okay. Like, you have your own journey on how this is going to unfold for you, and you have to just trust that and walk it through. I will say, on the other side, my son is 17 years old now. I say that community has really supported, and I couldn't do this without them. Without the Kens. Even Bender was the one in the beginning who even suggested I go over to the task force, right? So, and I had to listen into those things a little bit. I was kind of reluctant because it takes a while to accept. It takes a while to accept that this is the reality for you, right? And then all of a sudden you begin to kind of go, okay, this is where we're going to be. And for me, I dived fully in. But there's also people who don't make that choice. I will say it is very, very helpful to have someone who has sickle cell disease in your corner, and to work closely with your provider team. They are there to help you. They're not there to harm you. But it might take some time to figure out how that relationship is going to play out. We've also talked to a lot of our families about building a family plan is really, really helpful, and talking through, okay, well, what does our family look like when pain is present? And what does it look like when pain is not present? Because it's a very different dynamic at play. And so if you have those kind of these prep things in place, you can really support not just the person who has sickle cell, but this disease impacts the entire family. I have learned so much from my daughter who does not have sickle cell and how it impacts her. So those are some of the things I would say, but what, now on the other side, I always say, find a community, find a few folks who, are going through the same thing or similar things than you. It will be really, really helpful in the long run.
Foxy, I couldn't agree with you more about the child that doesn't have sickle cell and the psychological impact. I have a 5-year-old, and I just think that she don't remember things. And I remember when we first came back to Washington a year ago, she said, why do you and daddy always leave me with a nanny and you all leave with KJ and go on vacation for a few days? And I'm like, we're not going on vacation. I promise you we're not. We're in a hospital. And if you remember during COVID, you could not bring the other siblings into the hospital at all. And so it was a lot. And I think that we're still working through that and letting her being able to use her little voice and share what she thinks that's happening. And then also trying to get her to understand that you all are sisters, and your sister has a condition and you don't have that condition. And so those are the differences. And I will say that that's not easy. It really isn't. And so, thank you so much. And I never knew that you two sort of didn't necessarily want to be around an entire sickle cell community in the beginning of your journey. I didn't know that. I would say that I also went through that as well for the first 3 years. And you were part of bringing me out of that. And I thank you for it.
Yeah, we keep trying to draw you.
I'm here. Oh, no, I'm here.
No, you're in now. You're in
in.
now. The only other one thing I would to add is the mental wealth that is required in this condition. I didn't realize how much support you might need. And so now I'm a huge advocate of, from the very beginning, look at options for mental wealth, whether that's a counselor, group therapy. The task force now is doing a group therapy session, and it's just powerful to see. And I realized, man, I wish I would have started that from the beginning. And so I'm saying that to say for families, but also for anyone on the call who does this kind of advocacy work, we have to make sure that our families have access to quality mental services from the beginning, and not just the person with sickle cell, but the whole team. It would be helpful. So.
Yeah, no, thank you so much. And then we should go back. I'm gonna go to Megan, but I want to go back and talk a little bit about the yoga, the mindfulness that you also do with the Sickle Cell Task Force. Megan, when we were on the news together about a month ago, this question was asked to you, and I want to ask it again because this is a different audience. And the audience that we're being broadcast to is the Black community of Seattle. We're using converge intentionally to as many people as possible. Why is it so important for Black and Brown individuals to give blood? Why do sickle cell patients need blood?
Well, I'm sure Dr. Bender can say it better, but I'll try my best, which is really that of all the people who have sickle cell disease, many require frequent blood donations over the course of their life. Some, as many as 100 units of blood each year. And unfortunately, with the frequent transfusions, it can make finding compatible blood types more difficult. Patients can develop an immune response against blood donors that's not closely matched. And 1 of 3 Black blood donors, African-American blood donors, are a match for people with sickle cell disease. And so this is why we are really working with partners to make sure that the community who has this incredible gift of blood running through their veins that can be a life-enhancing gift to someone with sickle cell disease, that they are given all the opportunities to give that gift and to be a strong match.
Thank you so much.
Dr. Bender, you can say that more scientifically than I can.
No, I think that's the tough thing is, and it's a very tough message, right? Blood that's a perfect match for someone could come from anyone of any background.
Right.
But the closer the fit to you, the better. And it's more likely that you're going to find that kind of close fit with a brother or sister. That's obvious, right? And then a cousin. And then, as you move out, And so when you think about it, yes, I could be a perfect match for a sickle cell patient, but it's more likely that someone of the same ethnic, racial, geographic background of them be that perfect, match.
Absolutely. I'm going to go to you, Ken. As a sickle cell warrior, share your personal journey with sickle cell, and in particular, if you can also talk about back when you were a child and what you see the children have available to them today.
Well, my sickle cell journey when I was a child was a little different, only because that I didn't know anything about sickle cell. My family knew very little about sickle cell, and of course that was just yesterday, but it was a while ago, and so it was a little different. My journey didn't really begin until I was 18, when I moved out of the house and really took over my own care, trying to understand more about sickle cell. And it was a struggle, because I grew up here in the Seattle area, and I didn't know anyone else that had sickle cell. And I was trying to find a doctor that knew about sickle cell. And I pretty much found someone that was close by where I worked. He didn't know anything about sickle cell either. So we kind of joined together and went on this adventure. I'll just call it that, right? But I didn't meet someone else with sickle cell in Seattle until I was in my mid-20s. And I felt very alone and very, I would just say alone and not equipped to deal with sickle cell, and every day would be different. And it was a struggle because I was in the hospital at least once a month for a week, in my 20s. And it was hard, because you don't know anything about sickle cell, you don't know anyone else to help you, so you didn't have that sense of community. And it is, on the positive side, it's great that we have the task force now. We have a sense of community, a bunch of people that are connected with us, and we are connecting people with sickle cell together. I mean, because as Foxy had mentioned earlier, sometimes you're not ready to talk about sickle cell. And admittedly, some of the kids, I call them kids, they're in their 30s, but they're not ready to talk about sickle cell with people on the outside, but they're willing to talk about sickle cell with each other. And that's a great thing. It has been a struggle when I was younger. The first drug that I knew about that helped sickle cell was hydroxyurea, and I was in the clinical trial for that, and that really kind of turned my life around. I went from being sick a lot, meaning I was in the hospital at least once a month with a sickle cell crisis, to being 6 months without a crisis, 9 months, a year. And really, to this day, I haven't had a significant crisis in several years. I've had small crises, but that's a little different. But that was probably about 30 years ago when hydroxyurea came out. And it was a long time to get therapies before that. And so it was a struggle. And finding someone else and finding resources in the Seattle area was tough. So fortunately for me, I found another sickle cell warrior, Kendra Hoganson, and she connected me with the sickle cell camp, which was going on at, well, we are still working with that today. And that kind of gave me a lot more hope because I met a lot of other people with sickle cell. And to see people with sickle cell just, doing what everyone else does, right? Kids play, ride bikes, play capture the flag or stuff like that, and just being kids is great to see. The best part of it, though, was when they left camp, they would be connected, and they connected to each other, and that is a wonderful thing because sickle cell takes a toll on you in a lot of different ways, and sometimes you just need to talk to someone that knows, that has been there. So anyway, I could use all this whole time to talk about my journey with sickle cell, but that's a little part of it.
No, we're happy that you talked about that. That's why we invited you here, because like I said, I really mean that when I say that. Like when I look at you, I see inspiration, because we all have our different ways that we learn. We all have our different ways we like to consume information. And sometimes it's overwhelming when there's a lot of people around, at least for me and my family with sickle cell, especially if everyone has different type of ways that they deal with their mental health and therapy. And you always uplift it in such a great way. I'm going to come back to you because I want to ask another question, but I want to give you maybe a moment before I come back to that question. And Dr. Bender, Ken talked about treatments not being available 30 years ago. So what are the available treatments, including gene therapy, that are available or coming to market that might be game changers for the sickle cell community?
I love that question. And again, I think people need to be open-minded about what they mean by treatment, right? Because there's a tendency to wait for a problem and then try to fix it. So for me, so much of the education and time is learning how to prevent problems, right? The best thing is to not have a problem in the first place. So in terms of how to live your life, whether it's mental health, hydration, staying active, working on deep breathing, avoiding triggers, whether identifying and avoiding triggers. So learning how to live a full life while not triggering problems. Because, if you're not having problems, you don't need as much treatment. And then it's like picking up problems early before they get too far. But in terms of treatments, there's different kinds. I think the most important ones are the ones that prevent problems. And the first FDA approved one, as Ken mentioned, was hydroxyurea, which right now, depending on which form, this is where it gets tricky again, depending on which form of sickle cell you have, it's recommended for all babies starting 9 months of age. So anyone with the severe form, hydroxyurea, which has been shown to decrease pain, decrease hospitalizations, decrease transfusions, decrease stroke, and increase life. It's got other benefits as well. It's not perfect, but it does, it does all that. And then the next FDA approved one was L-glutamine, also called Endari. And that got FDA approved because people on it would have less hospitalizations for pain. L-glutamine is an amino acid. Okay. And then after that, the next two were voxelotor or oxybrita. And I think with each medicine, you have to ask, what does it do in the body and what has it been shown and proven to do in terms of outcomes? So voxelotor oxybrita is unique in that what it got approved for is it raises your hemoglobin, the number of red blood cells you have. So if you're living a life where you're at risk of possibly needing a transfusion and your blood counts are already low, a medicine that raises your red blood cell count decreases the risk of needing transfusion. We also know a lot of complications of sickle cell and problems stem from having a low hemoglobin. So the direct is raising the hemoglobin, but once you have a high hemoglobin, that has other beneficial effects, and people are in the process of getting proof of exactly what those benefits are. And then there's crizolizumab, also Adakveo, which is, of the ones I've mentioned, it's the only one where you have to go to a clinic to get it. It's given IV once a month. And I think one of the problems in sickle cell, people all think it's about hemoglobin or red blood cells, but it's actually very complex with red blood cells, white blood cells, platelets that help you stop bleeding, a bunch of other things. And the white blood cells that fight infection and save your life if you have a severe infection, they tend to be high in sickle cell. And the more you have, the more problems people have. Hydroxyurea lowers the number of white cells. Adakveo or crizolizumab doesn't lower the number, but it makes them more slippery. So they're not as sticky, so blood flows better. And that has been approved for pain episodes, although that information may be modified. It's not clear how well it works. So those are that kind of treatment. And then there's transfusion, which is unique because it can be used emergently when you're having a problem right now, or it can be used preventatively, giving them every month or so to prevent problems in the future. And then you move on to curative therapies, such as bone marrow transplant, right? Where the best results are if it's from a brother or sister with the same bone marrow type. And it doesn't matter if they have sickle cell trait or not, So the best are from a brother or sister, but it can also work with a stranger if they've got the same bone marrow type, doesn't have to be a family member at all. It can even now be from a parent who's usually only half a match. Okay. And now there's gene therapy, where the idea is it's like a bone marrow transplant, but instead of putting in someone else's bone marrow to make blood that doesn't have sickle cell, you're taking out a patient's own bone marrow and using one of several different approaches to change it and put it back in, so it doesn't make as much sickle cell, or it makes other things that prevents the sickling. There's several processes. So now there's more and more different possibilities.
Thank you so much. Yeah, absolutely. And, I want to go back to Ken, you all, just for a second, and I promise you I'm gonna move back around. Ingrid, I had one for you too. But Ken, as Dr. Bender just told us about, there's different ways of us looking at therapies and different ways of treatment. Ken, you talked earlier about triggers, and that some of the triggers you know now. I think that's what you said. Can you just talk to us a little bit more? So for families that's living with sickle cell warriors, how important is it to know the triggers, and what does sickle cell look like for you, right? When you know that a crisis is coming on, so it's so different for everyone.
It's important that you know your body, right? So for me, I start to get a little bit of tingling in my joints, usually in my elbows or knees, sometimes in my back. And then I just kind of note that, and I just try to increase my water intake, my fluid intake, just to help that if it gets, and then it usually will progress from a tingling to an ache, and then from an ache to a throbbing to then if it's really bad, then it's like a hammering in my joints, on my joints, that continues. And so, through this process, I try to hydrate, oxygenate. I pace back and forth sometimes, right? I try to listen to music as a diversion. But those are the things that start as small things that can build up to a bigger thing, like a sickle cell crisis. So triggers are, making sure you take care of yourself. One is, if you're sweating, make sure you drink plenty of fluids. I'm a big proponent of walking and doing some exercise, only because I feel better that way. It's not for everyone, but for me, that's what works for me. I also like meditation, relaxation, those type of things. Other triggers are cold, flu, fever, those things that our providers talk to us about. Hey, watch what happens with these things. Make sure that you are taking care of yourself. Like, I have a friend that has sickle cell as well, and he gets pneumonias, right? And because of that, he is very aware that is something that he needs to watch out for. And so that's, again, knowing your body to say, okay, I'm not feeling very well right now. I might be coughing more. I might not be breathing as well as I should. So, what is the next step? And this is a lifelong type of thing, right? You begin to put these things together. As you get older, you realize that some things are triggers. For example, cold. I dress in so many layers when it's cold out, simply because I hate being cold. Making sure that I don't get, too cold, and trigger a crisis. So these things that you can do is one thing, but the frustrating thing is that you could do everything right and you still have a crisis. And that is, I can't even tell you how frustrating that is. And that's the mental side of this disease that people don't see, right? It's like it is that time after time, I think I've done everything right, but still I have a crisis. And now I have to go through this again. I've got to go to the hospital again. I got to go to the ER again. I got to do this again. And that is hard to deal with. It is, but that makes you resilient, though, because you start to understand the triggers, you do what you can, and there's things that are out of your control. And as hard as it is to think that you can't control your own body, you have to move on from that. And that's a huge struggle. That's a huge mountain to get over. And especially when you're young, right? You're young, you want to be like all the other kids. You know what? I want to go out, play football. I want to poop. I could be the next Allen Iverson. I could, well, maybe I'll date myself there, but really, you want to be that kid, that person, to be able to do what everyone else does. But as you mentioned, you got to look out for the triggers, and there are some out there, and you really need to understand how impactful they are and when you need to escalate, meaning going to the ER or talking to your doc or those type of things. You got to learned what that thing is. It's kind of like driving a clutch, right? I don't know if a lot of people know how to drive a manual, but you know, but there's that point where it's like, okay, I can stall the car if I don't give it enough gas, but that jump off point where you need to go and seek help.
I appreciate that. Thank you so much. I think for everybody to hear that and to hear it from you, like you said, hey, I've been doing this for 64 years, and you're absolutely right. Especially a lot of times the kids want to play sports. I know right now we're in that phase right now. Like I am about to run. I'm like, and so it's a struggle. It really is. And Ken, I appreciate you from sharing your personal journey. I want to take this back to American Red Cross. And so Megan or Ingrid, either one of you can answer this question, but how can the broader community better support individuals with sickle cell disease and contribute to raising awareness and improving access to treatment and resources?
Ingrid, why don't you take that?
So I think just by being present in the community and letting the community know that the Red Cross is here to help, as well as to answer one, knowing the trust is there, open up and allow you into that community and would listen to you. And I think it's so important that we keep that presence in the community, as well as educating and working with the civic organizations and the fraternities and the sororities, because a lot of members of these organizations have very prominent roles in the community. And once you can get them on board and they understand to them as well. And I think that's just what's so important. And then also with working with the American Red Cross, we've worked with a lot of celebrities. The younger generation knows, like from Lorenz Tate, who's an actor, TV, and talking about sickle cell and the importance of testing and donating blood. And I think working with celebrities as well is putting them out there.
Thank you so much, Ingrid. We appreciate and just looking at how
Follow up by saying, the Red Cross in general, whether it's our, response, we are really just a vector for allowing communities to be a part of their own resiliency. And I think this is a prime example of that. How people who have a life-sustaining blood product within their own selves to give that to a fellow community member who needs it. And so that's the piece where, we're really trying to find the depth of trusted relationships in the communities so that we can be a conduit for that community, supporting itself, supporting each other. I really believe is that is needed. Katie, with and the folks who are already trusted in these communities that allows us to be that conduit.
thank you. Oh, that's cool.
And also, the biomed side, which is my side, and the humanitarian side, working together as one problem.
with sickle cell. Yes, we make sure that they have access to quality care, but we also have to address housing because it's a real issue, and sustainability. And what happens if a person can't work? Maybe they can still feel. How do we help? Not just sickle cell. I want to say that anyone who is not well, necessarily as well-bodied as another, how can they still participate fairly in community? And how can we see them as wise, brilliant, amazing people, and not just, people who need, but also people who give? How do we do that, right? And just really supporting the holistic person is what the task force right now as a nonprofit is just working through, as we are meeting with family after family and realizing, whoa, this is way larger than just sickle cell and how it impacts the body and impacts the life. So that's some of what I would say. We also, obviously with these new therapies that are coming out, they're super expensive. So the question is who's going to pay for these things? And so we're constantly trying to advocate around access to quality care. But I'll stop there because I'm sure maybe others want to chime in.
No, but you hit on so many good points, right? I mean, food, you talk about food, good food, having access to medications, let alone vitamins. I mean, it's a lot. So I think that you hit on really key points, and you know better than a lot of us, as you don't just work with your own children, but you work with many individuals, which I do want to go to Dr. Bender, but I also think that Ken and Minnie could probably respond to this too. But how do we navigate expectations, Dr. Bender, for patients and families as they look for answers and hopeful options in medicine? I feel like Foxy really covered a lot of it. Community, ensuring that we have community with us, community that lives with sickle cell, places where we can go and just be ourselves and be just like everyone else, but within that community. Can you talk to us about the other side of it? How do we navigate expectations for patients and families as they look for answers?
Yeah, this is one reason why I think it's so important that people be seen by true sickle cell experts. One of the big problems at a lot of institutions is anyone can come in and say, oh, I'm the sickle cell person. That doesn't say anything about what they know or understand, right? And going back to the government, there's so many things that can be done politically, but in other states, they're working on higher reimbursements for people and providers that provide metrics of high quality care. So that if you're a provider that your sickle cell patients do better, then you get more reimbursements, right? The reason I say it's so important seeing an expert is to address your question. For me, it's all about honest risk-benefit ratio and what to expect, informed consent, right? No treatment is perfect. Most treatments have some potential side effects. And so to paint as realistic picture as possible with the information we have for each medication, for each treatment, for what to expect. Some of them, if you do it every day, dramatically, it will prevent problems, but it's not complete. Some of them, it's not so dramatic. Some potential side effects are really, really rare, but everyone's, scared of them. Others are really common and people don't talk about them. Others are common, but they're really minor. So just making sure families have as realistic picture as possible of what to expect with each one of them and to not promise too much.
Yeah, thank you. No, I appreciate that. And it's so different for everyone too. And I think that that's the biggest piece there. And that's something you shared with us at the very beginning, Dr. Bender, that sickle cell is different for each patient.
It's different for everyone. And I think one of the big problems is, especially with teenagers, is they say, oh, well, I took it and it's not working. And this is one of the problems in terms of non-opiates and opiates. Ken, I'm so glad he talked about hydroxyurea and how it changed his life. But hydroxyurea isn't perfect. When you take it, you don't feel it working right away. It often takes months. And it's more that this year was better than last year. And teens don't like investing in that, right? Why should I take it? I don't feel different. And oh, I was still hospitalized, as opposed to other medicines like opiates, where you feel it instantaneously. And so you know it's working. And so how to get support and buy-in of families and patients for those long-term treatments that really will help.
The lifespan. Yeah, absolutely. So Ken, I'm gonna go to you with this question. We hear a lot about poor transition to adult care is one of the most pressing and critical gaps to address in sickle cell disease or sickle cell condition. What policy or other changes can be made to address this gap?
Well, that's an interesting one. I think that establishing a medical home to begin with, right? Nothing will go forward if you don't trust your provider or the people that you work with. So finding a group or a person that you can trust and communicate with, and that's the big part right there. Okay, so one, finding a doc that or a provider that you can communicate with that has your views in mind. I mean, not everyone has the same thoughts about how things should go, what drugs to use, what protocols to be used. So finding someone, provider that is one, knowledgeable, two, you can communicate with, three, that will help you advocate for yourself. I mean, those are the basic things. It is important, especially at that age. And I know when you're a young adult, you don't want to take on all of this. This is a lot. I mean, this is a lot for someone that doesn't have a chronic disease, let alone you have a chronic disease. And it's like, okay, you know what? I don't want to deal with this. And this is what happens. You know what? I'm not going to deal with this. I'm pushing back. I am just, going off the grid. I'm just going to, live my life day by day. And then, yeah, and because you hope that you can avoid it, but you can't avoid it, right? Some days will be good, some weeks will be good, some months will be good, but eventually there'll be some kind of impact that you will have to deal with. And I think the sooner that you can try to come to grips with that and then find your balance. I mean, that's the key there too, is there's a balance that can be struck. But it's hard when you're young that's a lot of stuff. I mean, and it is hard to understand where you are in the journey and understand that it's your journey to begin with. You have control over it. You can have a successful life and be do what you want to do. And having that sense of hope and having that establishing goals and fulfilling them is one of those things that keeps me going anyway. And I think that it keeps a lot of others going as well, knowing that there are options, not only medical options, but there is also options on how, work. There's a lot more options now than there used to be. And things that fulfill you, right? As someone with a chronic disease, sometimes you don't feel fulfilled because of all of these other things. But there are things that you like to do. I love music, so I go to lots of concerts. Like tonight, War is at Jazz Alley, so I'm going to see that, right? That fulfills me. that makes me think that I can take another step, go another day. And that's really what I think that we need to instill in our young adults and help mentor them through the hard parts, because that will get you through some of the hard parts, not all of them, but at least, you have that hope, that feeling that, this is a different day. This is a better day. But you have to make that for yourself. And that's the thing. You could, of course, like I said, push back and avoid, but how long was that going to last?
Thank you so much, Ken. I really appreciate that. I was gonna, Foxy, if you had anything you wanted to add to it, I had a question I really would love for everyone to answer, and I can come to you first with it, unless you wanted to add something to that piece. We're getting close to closing soon here.
I just would say, transition is an interesting thing because obviously, you're like everyone who transitions from young adult to adulthood. You did some fun stuff. You did some things that, you may not tell your parents, all these things like that is really happening. I love the work that some are doing now in honoring that part of transition and not just seeing it as your sickle cell. It's your whole life. So we should be thinking fully around what you want to do and can do. I just was also going to promote that nationally, it seems like everyone is starting to talk about transition more and more. And so you're seeing more collaborative works on supporting the transition period and supporting it with honor, not just like penalizing because you're transitioning. You need to feel like, oh my gosh, I have to take all this on. But I think on our side too, it's about, if we know that this is that stage, how do we build a large net to support people, knowing that they kind of need to while out a little bit, right? And so giving them that opportunity, we know what the risks are. So we want to be clear about that, but we also don't want to penalize them. Oh, you got older and now, it's all this weight on you. No, we have a large net to support you through that part of the journey. That's what I would push on policy side. How do we build these larger nets to let them kind of still be young adults and while out a little bit, and we can carry them through until they get to the place where they can be stable. Yeah.
Yeah, that's a great point, Foxy. The reason I left the house when I was 18 was because my mom was a micromanager, right? Of course, she wanted the best for me, but she wanted me to stay in the house. She wanted, me to avoid all of these things. And, it just made me want to do them more. I wanted to do them more. So, and that's the thing. So to Foxy's point, yeah, you don't need to micromanage, but you need to be there when it's necessary. Sometimes I get calls from some of the young adults and just want to talk, just reach out.
Well, Ken, I think I'm gonna get KJ your number, because she's like just trampolines everywhere. She's a flipper. All she does is flip, and I'm like, I just go like this sometimes, just cover my eyes, and that's helpful to hear too from a parent. Because you're right. When I was a kid, whatever I heard, I want to do it more, and so it's the same thing. I want to transition because we are getting close to close. And I want to thank all of you for giving me 90 minutes on your Saturday, the first Saturday in October, and it's beautiful outside. I know that's not easy to do, so I appreciate you all. But I think that we would be remiss if we didn't talk about COVID. How has the COVID-19 pandemic, right? We're out of it, kind of, affected people living with sickle cell disease, and what are some precautions you had to take? And, Ken, if you can answer the question from your personal experience, Dr. Bender, if you can answer the question from a medical, Foxy, if you can answer the question from a mother and an advocate. And then I think, Megan, I would love to hear from you in particular about blood during that time. So COVID-19, let's roll the clocks back 3 years. How has COVID-19 pandemic affected people living with sickle cell?
Well, for me, and it, a lot of the people I know with sickle cell, were at home. It's like, we were at home, didn't want to work or be exposed to others simply because of it. And that kind of created a kind of a loneliness type factor there. because you just want to not get COVID for one, and two, the best way was not to be exposed by exposing yourself to others. So for me, it was not bad simply because I work from home a lot. But for others, it was a struggle because then you have to mask up. You had to remember the protocols, wash your hands, and be that person that is like, well, maybe I'm out, but I'm masked up and taking my precautions. But so for I think for me anyway, it was stay at home, stay away, take precautions.
Thank you so much, Ken. I appreciate that. And then Dr. Bender, I remember we had a really bad crisis and I called you and we were talking about, hey, let's try to stay at home as long as possible. Because this was April the 18th of 2020. So we were like maybe a month into the pandemic. Can you just talk a little bit about from your side and your point of view of what happened during the pandemic?
Yeah, I think first of all, sickle cell can be stigmatizing, unfortunately, something society needs to work on, and it can lead to isolation. So you add a pandemic to it. So the mental health pieces, and awareness that people have brought up were huge and are huge. I think it also points out the importance of triggers. What we saw was a huge decrease in hospitalizations. And some of it is people were staying at home, not overdoing it, not, getting in fights, arguments, wrestling, trauma, infection, those things that can trigger episodes. They weren't overdoing it, and so I think the lesson is, there is a rise again this fall, is maintaining good practices and think about masking and washing. And if you're sick, isolating and checking the environment you're on and avoiding triggers. And then talking with care providers in terms of the situation with your local clinic and hospital, because often it's, yes, definitely go in, come in, be seen. And other times it's, depending on what it is, it's better not to. There's a tendency for a lot of providers that aren't sickle cell people. If you call, they say, just come on in. Well, often you can talk things out on the phone and avoid coming in. You just have to find the right person.
Yeah. Do you want me to go
Yeah.
for it? Okay. Bender, what you just said about, I feel like in some ways, we talked in the beginning about the beauty of sickle cell. It's also the beauty of COVID was it kind of leveled the playing field a bit to sickle cell and others, right? Because all of a sudden everybody had to be inside. So you didn't feel too like some folks were like, man, we've been doing this kind of stuff in the sense of isolation. I did see for my own kids less navigating the triggers was really kind of, I'm not going to lie, it was really helpful. It gave us a little bit of a break. Just to be like, oh, we don't have to go out in this rain. We don't have to go out in this wind. We don't, there were certain things I was just like, ooh, this is kind of nice. And I think it helped other people to just know what it's like when you just have limitations that you can't live into. So I feel like that kind of leveled it. On the other end, we just finished our young adult retreat with adults with sickle cell, and I hear some of them really talking about not feeling comfortable in larger spaces, not feeling, so I wonder if anxiety has increased over the time of COVID, dealing with that isolation now coming back, and people are really, young adults especially, I'm finding they're very anxious and nervous about interacting in the community again. And I can't help but imagine that that's partly from the pandemic. So that would be my answer to that.
And I'll jump in. For me, and the American Red Cross, it's less personal than it is for so many people on the screen, because our concern was really about the blood supply. And over the course of the COVID-19 pandemic, we saw some peaks and valleys in the national blood supply. The Red Cross has a commitment to making sure that care providers have the exact right blood product for every single patient, making sure that that's on the shelf. And the way we do this is by encouraging blood donations. Specifically, we've talked today about diversity in our blood supply. And during the pandemic, especially those early days, people were wondering, is it safe to be at a blood donation center where other people are? There was so much fear, there were so many unknowns. And so many of our blood drives, as Ingrid mentioned, are in schools and churches and businesses that were closed during this time. So we really lost those sort of natural pipelines for blood donation and had to get really creative about how we collected blood. And we sort of mobilized all different ways to make sure that people understood that this was a critical need. And even when there was a quarantine, you were, invited to leave your house and roll up your sleeve. And the other side of it, though, is that as a human community, we felt helpless during the time of the pandemic, and people wanted a way to help each other. And so we did see people bravely emerge from their homes, put on their masks, and roll up their sleeves and donate to one another. And those people were heroes in that moment, and they're heroes now, especially when we talk about the need, from sickle cell warriors for a specific blood type. And so the pandemic was a really interesting time, but we saw what we always see, which is that people find a way to come together and to do what's needed to help their communities.
Thank you so much, Megan. I appreciate all of you. I want to let you all know that we received the proclamation, however many of us is on the screen. I want to thank all of you for being here, and we'll make sure Foxy and Ken, you in particular, that you all get a copy of this proclamation as well. Personally, being a person that has really been engaged with sickle cell since my daughter was born, I'm going to be in this work to the day I die. I know that for sure. And what I want to say is that we all have our different strengths. And I would say that my biggest hope for sickle cell is that we can really get into breaking down and studying sickle cell more intently for each individual type of trait, that we can really get down to that level. And then for the community, that we understand people living with sickle cell. And of course, Dr. Bender, you're getting one. But people living with sickle cell, they're just like all of us. And like Foxy said earlier about having inspiration from Ken, I have inspiration from Ken too. And I also have inspiration from my 8-year-old daughter, just seeing what she goes through and her positive attitude about it. And sometimes when she says things that make me have to think twice as well. I remember we had a little bit of pain the second week of school, and we missed the entire week of school. And the great thing is we were able to manage the pain at home. Of course, talking to our doctors, it wasn't too extreme. But when we had her in the hot water, and people who live with sickle cell know what I mean, Foxy has guided me through this the first 2 years of her life, the really warm water and putting the Epsom salt in there. She's like, I feel so good. Like, is this the rest of my life, mommy? Am I going to have to always be in water, warm water, to feel good? And I'm like, KJ, I don't got all the answers, but I tell you this, I'm going to be in it with you, right? And giving ourselves that grace to not have all the answers. And like Foxy said earlier, just being there in community sometimes. Sometimes the community could be several people living with sickle cell, and sometimes it could be your family. But I really want to thank each of you for coming here. I want to thank you all for the work that's been happening around sickle cell, and just knowing that we are a fluid sickle cell community. And we want to thank you all so much. Sickle Cell Task Force, thank you for all the groundwork that you put down, all the work that you do that people don't see, and the work that people do see. Thank you. American Red Cross, I want to thank you too from working with us. We were working for almost 1.5 years to make this happen, and I'm so happy that it happened this year. And Pfizer, Annie, thank you for coming and working with us. And Dr. Bender, as always, even when we lived in Florida, I was able to call you. I appreciate you so, so much. And to Katie Hall Foundation, Maria, our new program manager, I want to thank you too for getting us all together today. And Converge, we appreciate you for broadcasting this for us. And with that being said, I want to give you all back 4 minutes to your weekend so you can go out there and enjoy this beautiful sun. And Ken, definitely send us back some pictures from your concert tonight. Awesome. Thank you all so much. We appreciate you so much. And thank you all to all you sickle cell warriors and sickle cell warriors supporters. Thank you.
Thanks for the opportunity.
Oh, of course, thank you. And definitely we'll mail all of you, email you a copy of the proclamation, and we'll mail it too. Thank you.
The recording has stopped.
All right. Can you stay here with me just for a second, Maria?